Good evening, everyone, and welcome to Talking HPD. It's another Friday night, and it's tonight, all you ever wanted to know about COVID-19. Now, I'm sure you're sick of hearing about it, like all of us are. However, we've got the best opportunity in front of us to ask two people who are very well educated in this space some of the questions that might be on your mind. Goodness only knows, we've also got Scotty, but what he's going to contribute is anyone's guess, to be honest.
Just here as a pretty
yeah, he's here for looks alone. So what we're going to do, first and foremost, Becky, we're going to ask you to introduce yourself, if that's right. Just a little bit of you and a little bit of your background.
Yep. Hi, my name's Becky. I'm a respiratory specialist physio by background, and I currently manage and I'm the superintendent for inpatient physio at the Royal Surrey. I've spent the last 10 years looking after patients who suffer with chronic respiratory conditions and acute medical conditions. So I've worked across inpatient and outpatient care, looking after different patients, helping them with their breathing exercises, fatigue management, and all of their ongoing respiratory management.
Amazing. Excellent. Thank you very much. And Talib, welcome back. But let's give you an intro, just as a reminder, in case people haven't seen any previous episodes.
Hi, I'm Talib Abubacker. I'm a GP in Central Luton. I've been there for about 25 years and see lots of different things. And we're part of the team that are vaccinating in Luton PCN. It covers 50,000 patients, and we've already done about 10,000 vaccines. And I was vaccinating all afternoon.
Excellent. So Talib is rapidly becoming a man crush of mine, I'm not going to lie. I really want him as a GP, but I'm moving away. I'm moving out of the Luton postcode. I'm moving to Potton, so it's going to be less chance of having you as my GP now. But anyway, I'm not bitter, just disappointed. Scotty, give yourself an intro.
Yes. Scotty, as you may or may not know, strength and conditioning coach and slightly full of cold at the moment, not COVID-19. I did a lateral flow test today. Personal trainer at Hills Physical Developments. Very much here to listen to the questions being responded to rather than try and answer anything myself.
Fantastic. Welcome, mate. All right, so let's get going. You know, when we talk about COVID, there's been a huge amount of government campaigning around what we should and shouldn't do, what we should look out for as far as symptoms go. So let's start with that, Talib, if we can. What are the symptoms that we now know a year in that we should really be looking out for when it comes to COVID?
Right, okay. So the symptoms of COVID are, the main ones are still exactly the same as when it all kicked off. So it's a high temperature, a persisting cough, a new cough. So someone who's got, say, for example, chronic obstructive pulmonary disease will have cough. So it's, you know, some people say, well, I've always had a cough. It's a new cough that's persisting, or a cough that's different from your normal cough, and loss of smell or taste. So they're the three main ones. But as COVID's gone along, you know, COVID is a mimicry virus. It seems to mimic other things as well. So I think if anyone's had aches and pains and slight fevery feeling, they should get tested. And the testing centres are all still open. You can ring 119 or much easier to go online to the 111 online and book yourself tests. And so muscle aches, diarrhea that's persisting, or if you've been exposed to COVID, so been close to someone who's had COVID and you start to get odd symptoms, I would probably get yourself tested.
Excellent. Yeah, and obviously all of us are sort of, we've had it drummed into us what precautions we can take to look after ourselves and obviously our friends, colleagues, loved ones, neighbours, whatever. But what about giving us a reminder of what those guidelines are, Talib?
So the main guidelines really is, if you've got COVID, you should be isolating in 10 days. It used to be 14, but now it's 10. And that's the whole household. People next, you know, if you've been in close contact with people within your household, you really need to isolate yourself. to stop the spread. So that's the main one. And then obviously get yourself tested. And so many of my patients who, you know, it still surprises me, still a year on, people say, well, I've had this cough, but I know it's not COVID. Well, there's no way you're going to know it's not COVID until you've had a test. And the risk there is you're guessing that you don't have COVID, and then you go off to work or get on the bus or whatever, and then start spreading it to people. So it's really important, if you get any of the symptoms, you get yourself tested. There's plenty of places now to get tests, and it's so much easier, and the results are coming back so much more quickly. Yeah,
which is obviously a good thing. And obviously, as we've gone throughout the year, a number of vaccines have come on, you know, in leaps and bounds in a very rapid space of time. So can we talk about a few of those vaccines? And, you know, if you've looked at the news over the last few days, weeks, months, you can't help but have noticed, you know, that they are getting different responses in different countries, for example. The different types of vaccine are getting different responses. What's your view, Talib, as a GP, on their overall safety?
Well, the two that's been that we've been giving out in the UK, the first one that came out was Pfizer. And we don't need to get into the technicalities of exactly how it works, but it's an mRNA vaccine. And then you've got the AZ AstraZeneca vaccine. They've both been licensed. We've given over 20 million vaccines in this country, and the results have been absolutely fantastic. Well, people got to realize that there's a few myths that are going around. People are saying it was rushed through. The main thing about it was because COVID was such a massive pandemic with so many people dying, they had to get vaccines tested and researched and out as quickly as possible. So what they did was, it was tested across the world. So it's one of the only, not just a vaccine, but one of the only drugs that have been so heavily tested across different ethnic groups, different countries, which is absolutely fantastic. The second thing is, what normally happens when a drug gets into the market for the first time, you've got all the research tests, and then once they've done all the research, they then submit to the various regulatory bodies to say, is this a safe drug? So that might take a year or two, and then they put out the results. But what they did with this, because of the pandemic and the number of deaths that were happening, they, at each stage, they got the regulatory bodies like the MHRA, like the World Health Organization, to look at the data as it came out. So that was how they were able to actually put things through really fast, rather than cutting corners. So there was definitely no corners cut, and the data is fantastic. The vaccine really does seem to work, and what it does do is stop people going into hospital and stop people dying, which is the main thing. And there's a lot of data about it not, well, it doesn't make you ill as much as if you didn't get vaccinated. So all the vulnerable people, which is what I think the government have done really well, is actually target those first, have actually been covered, the majority of people, with the vaccination program. But what it doesn't do, you can't guarantee that you can't pass it on. So you might get a lighter version of it, but you may still be able to pass it on. And that's why it's still really important that people follow the rules after being vaccinated.
Yeah, absolutely. So we'll probably come back to the vaccines, I think, but let's take a step back first for those people who may have had experience with COVID, and obviously when I use experience with COVID, it varies from person to person. Clearly, there are people who will have got a positive COVID test but will have been asymptomatic, through to people who are very, very ill with COVID, or have now got what they are terming, and again, I don't know much about this term, but long COVID. So Becky, I'm going to come to you if I can, because a little bit to bring your respiratory knowledge into some of those questions. I think if someone has had COVID and has been ill, particularly from it, are there any outcome measures that we can use to track, you know, and to help them on their road to recovery?
Yeah, there's quite a few. And just to go kind of back on your point that you said about, we've got those people that are suffering from the effects of having COVID. So you've got those people that are living with sort of the after effects of having a virus, which is quite normal and can last quite a few weeks. And then you will have the long COVID. So again, that's a differential diagnosis. GPs would generally diagnose it, but the benchmark term for long COVID is for symptoms that have persisted for more than 12 weeks. And the thing is, it's a working diagnosis. It's going to change, and it's not always set in stone. So there are two sort of different areas to look at. But generally, most people are going to be in that post-COVID recovery phase, particularly the younger people that we're seeing. We're not used to suffering from a virus and having it take some time to get back to. So outcome measures are often more self-reported in COVID's instance. So it's more about looking at things really simply. So the Borg scale, which is a measure of people's breathlessness and their fatigue. So patients would look at the scale. Depends on which one that you use. It can be a 1 to 10 or a 6 to 20. But patients can look at that, clients can look at that when you're working with them, and report when they're at rest, where they feel, once they've done their exercise, where they feel and how long it takes to recover. You've got things such as self-reported questionnaires. So I will just use some letters and numbers at you, but there's a questionnaire called the EQ5D, which is what a lot of the COVID services are using. So there is a national program called Your COVID Recovery, which uses that as a self-reported patient questionnaire, because it is all individual. And as we've spoken about earlier, there's a lot of symptoms that different people will have different things, and there is no one sort of pattern that's the same for everyone. So it's about comparing the patient or the client from when you first saw them to a bit later on. So it's really good to use a patient reported questionnaire. From a physical perspective, it depends on when you're seeing clients and people. So a sit to stand test is really easily replicated if you've got a virtual appointment. So a lot of our first sort of physical tests are sit to stand tests. Then we move on. So if you can see patients face to face, it's about looking at either a 6-minute walk test or something like an incremental shuttle walk. We would generally use the 6-minute walk test because it has a defined time, whereas the incremental shuttle walk, if you've got patients that are tipping into long COVID, you're at risk of them burning out before you've even done anything. So 6-minute walk test is generally good. So really simple tests that just measure someone's immediate abilities and how they feel about it, because COVID generally has a lot of psychological, a lot of social factors, as opposed to just that physical disability.
Absolutely. And who's reading that?
Sorry?
I can hear my voice back, I think. Oh no. Yeah, no.
I can hear an echo.
You can what?
I can hear an echo. I can hear your voice twice all of a sudden.
You're such a dick. I can hear an echo. You what? I can hear an echo.
Oh, yeah.
Anyway, sorry. I'll cut this out. So, let me go to my next question. Right. So, for those who have had COVID or are recovering from having had COVID, what would be the recommendation as terms of exercise that can help them with any breathing challenges they might be having, Becky?
So I think it's really important, first of all, just to make sure that people have got over that initial the acute phase of having COVID. And it's really hard. It's the same with any other virus that we could have, in terms of we all have that want to get back to things perhaps slightly too quickly. So it's about that kind of initial letting our body recover first, making sure that we are feeling ready to do things. From a breathing aspect, we can do that slightly quicker, and that's management that you can do all of the time. So there's two different sides that we would encourage people to go down, and this can be whether they're patients in a hospital and they're admitted, or whether you're managing COVID at home. So the first one is getting yourself into certain positions. So lots of people will have seen on the news what we call proning teams. So teams that get the really sick patients that are ventilated, turning them on their front. And that works really well for ventilated patients, but also works really well for conscious, awake patients. So the best thing you can do at home is, for as long as you can tolerate, lie on your front. It's really good for your lungs. It helps kind of compress your lungs so that they become easier to get the airflow in, without going into too much technical detail. So lying on your front really helps with your lungs' ability to take in the air and get the oxygen in. The times when you're not lying on your front, you can practice sort of controlled but relaxed breathing. So very kind of steady, breathing in through your nose, breathing out through your mouth, but what we would call sort of pursed-lipped breathing. So a really controlled breath out, so that patients are able to regulate their breathing. By doing that, what you do is you think about taking your breaths and you automatically slow them down. So that helps with that feeling of panic, that feeling of breathlessness. Sometimes that doesn't work for people if they're really short of breath and they're struggling to get the air in. Obviously, you need to be aware of when you need to call for help. But on a general basis, where you're feeling like you're a little bit puffed out after getting up the stairs or something like that, having a sit down and doing some steady breaths in and out is always a really good start.
Excellent. All very good tips. Okay, so now let's talk about, we'll switch it up a little bit back towards when we've had the vaccine, because there's obviously millions of people in the UK now who've had their vaccine. And I'd love to know, Talib, from your point of view, when you've had your vaccine, how quickly can you get back to normal as far as exercising, I should emphasize? So when can I start exercising after my vaccine?
For most people, they don't even know they've had the vaccine. They feel perfectly fine, absolutely no problems whatsoever. But about, and the figures range between 10 to 15%, may have some form of side effect. And the most common ones are a sore arm, a slight temperature, maybe even aches and pains. And that can be the same from any vaccine. All your travel vaccines can do exactly the same. And I tell people exactly the same after those. So what I say to people is, if you're going to react, you're going to react in the first 24 hours. So for most people, it'd be sensible not to exercise for the first 24 hours. And if you're like me, an elite athlete, wink, wink, I wouldn't want to push myself too hard in that first 24 hours, because you just don't know, because you know your immune system is learning to fight this COVID, and the vaccine teaches it to do that. It takes up to 4 weeks for the immune system. Well, they say 2 weeks you'll get a good response, where you're covered 90% of the time, but a good 4 weeks for it to be fully formed. But in the first 48 hours is when it's working hard to trying to do something. So if you then go and do something extreme on top of that, then the immune system, I always think of the immune system a bit like an army. It's there to protect you. Yeah. Where you don't want to be fighting two fronts at the same time, i.e. rebuild your body from your exercising and also put a response out for against the COVID. So I normally say to people, look, try not to push yourself too hard for 24 hours and then see how you go. And then listen to your body. If your body's aching and feeling a bit feverish, don't do any exercise. Take your paracetamol, take your ibuprofen. And what I found, most people who I speak to, I tell them, look, take it before your temperature goes up. So take it as soon, you know, within 2 or 3 hours of your vaccine, and then take it again a few hours later. And most people who've done that don't seem to have any problems. So exercise is good. We all know it. So going for walks and things like that are fine. I just think if you're due a long run that day, for example, don't go for a long run. If you're due heavy legs day with weights and things like that, don't do it that day. Just leave it 24, 48 hours.
Perfect. Scotty, from your point of view, any questions that you want to ask as a complete layman in this space?
I think you guys have just jumped in and answered most of them before I got a chance to fire out my questions, you intelligent buggers, you. No, I mean, I've worked with about, excuse me, 3 or 4 people that have had COVID and have come out the other side, and they've started getting reintroduced to their online training programs, and been very much just been working on a, you know, perceived rate of exertion scale, and just saying, look, we are going to work. I mean, I'm famous for torturing people, but in this case, I've been, look, we're working, you know, 6, 7 out of 10 max. We're not doing burpees in your living room. We're doing some mobility drills. We're just going to try and, you know, keep plodding along, and then week in, week out, just slowly increase it ever so slightly, and just take a very cautious approach over a period of time. And one of the lads, bless him, he suffered heavily with fatigue, so we started doing 20-minute sessions with him, and then we've built that up, and we're now doing 60 minutes again. But no, pretty much such in-depth answers already, guys, that you've covered all my questions.
Worst interviewer ever.
Yeah, I know. I got nothing. I've contributed nothing. Just sitting here going, well done, fantastic.
Well, I think you made a really important point there. I mean, I got COVID, unfortunately, back in May last year, and I was very fortunate. I had it very mildly, so my good wife looked after me really well in my bedroom while I isolated myself. So it was like being on holiday for me, and my Netflix up and everything. I was working as well, doing telephone consultations, but you know, and I do a bit of running. I've run marathons, and I was sort of thought I'd done 12 miles the week before. I was ready to do my 12 miles, and you know, a mile absolutely shattered me. I just could not, and I couldn't believe how much, even though I was quite well through COVID, and it probably took me 3 months to get back to where I was before. But I listened to my own advice and just did it really slowly, gradually built up, let my body tell me what I can and can't do. And some of the breathing exercise that Becky mentioned, they're really important. So it's, you know, your body, the immune system is a fantastic thing, but it just can't do lots of things at the same time. Particularly for endurance athletes, you know, so many marathon runners, for example, are after their marathon, when you think they're at their fittest, soon after the marathon, they get coughs and colds and things like that. So it just shows that your immune system takes a hammering with heavy exercise. And that's why you've got to be really careful that if you think you've had any, and this is even outside COVID, you know, just having a chesty cold or something like that, just don't push yourself too hard after it. Allow that week or two to recover and gradually build yourself up.
Yeah, that's why I don't exercise. In my opinion, it's bad for you.
I told you
one of
years ago.
The other things that you're perhaps that we kind of overlook a little bit. So from a strength and conditioning, from an exercise point of view, it comes a bit naturally to kind of PTs, physios and things like that, of how we manage people, what we look for. And as Scotty was saying, you look at where they are on the scale and you take things gradually. But I think one of the things that we really have underestimated in all of our patient and client groups is the taste and smell, because it's something that actually isn't causing any physical harm to someone. We really disregard it, and actually really affects the nutritional status of a lot of the patients, and particularly high end and elite athletes as well, because the loss of those senses affects your want to eat food. Now, most of us enjoy food more than we should, and it's not just a fuel source. We want to have it, and we stop wanting it the second we stop tasting and smelling it. which is obviously then going to have an impact on your physical reserves and your ability. So not only have you had a virus which has depleted your reserves because you're unwell and you're needing to fight that infection, you're then not rebuilding that and putting that back into yourself for quite some time afterwards. And I think we really just underestimate what we need food for. So getting that early intervention of making sure that you are on a good meal plan and you are eating the right amount of food, the right calories, the right things, can be really key to getting people back on that recovery as well, whether they're sort of your low level chronically unwell patients anyway, or your high end athletes. There is something to be said for having a really good nutrition and dietetic input.
I'm pleased you said
Brilliant
that.
angle.
That gentleman that I said about before, who reduced his sessions down to 20 minutes, he did text me one night. He must have been having a bit of a panic and said, "I'm suffering with this fatigue, Scotty. What can I do?" And I wanted to text back something immediate, so he knew that I just used that common sense approach of, well, make sure you're getting your fluids in, make sure you're eating healthily, make sure you're getting your sleep. Just kept it real simple, and then that gave me time to go on some websites and do some research. And with the NHS website, it basically says, make sure they're getting sleep, they're eating healthy. And I was like, oh, thank God for that, you know.
We're really focused on the fact that because this is new and we don't know how it presents and we don't know what it does, that the treatment must be new as well. And I think what we've kind of established this evening, as well as in lots of other clinics and areas, is that the treatments aren't new. It's just about knowing what to use and when. So graded exercise works really well for the people that have that kind of post-viral recovery. It isn't going to work well for a really small number of people, but that's the same for a lot of other illnesses and a lot of other viruses. The nutrition, the hydration, all of those things, like you're doing it now with your cold, you're making sure that you keep yourself hydrated. It's all of the basics that we forget because we think that we need a new treatment.
Really good point. So the next question I have, and it's really the final question, unless we go off somewhere else. I don't know what that echo is. Don't know where it's coming from.
Only happen when you talk.
Yeah, it is, isn't it?
Yeah. Talib goes all slow all of a sudden, and then you're echoey for some reason.
Yeah. It's very annoying. Anyway.
Becky's perfect.
As always. Come on.
Yeah, I know. Go off, people, you know. So, final question, Talib, if you don't mind. When we talk about COVID and people talk, you know, everyone is hanging their hat on the 21st of June, and then it's all over, in theory. Not in theory, I don't think, actually. Realistically, what does the future of COVID look like? Because we're constantly hearing about new variants. We're constantly hearing that this could be with us for many years. So what, in your perception, and I'm only asking for your opinion, really, I know you can't give too much detail, but what is your perception of what the future could look like?
I guess that we have had examples over the years and centuries, but if we looked at the Spanish flu, for example, that took 2 years, and that's without the technology and the knowledge that we have now, no vaccinations and things like that. So 2 years, we've been in it a year already. So I'm hoping things will burn out. If we did absolutely nothing, things will burn out themselves anyway over 2 years. What people got to remember is when a new virus jumps from an animal species to humans, our immune system's never experienced it before, so we don't know how to cope with it. So, you know, like the immune system being an army, this army suddenly, you know, if it was an army of cavemen, they've never seen cannons before, and it's going to take them ages to work out how to fight against cannons, but eventually it will. And so the immune system is being shocked into, what the hell is this? But then as it gets exposed, and as the communities and everyone starts to get exposed, particularly what vaccine does is speeds that process up. What you'll find is even the variances that you get aren't as dangerous. Yeah. So, I don't know if you remember, SARS was very topical a few years ago, and we suddenly thought, what's going to happen? You know, the Far East have been exposed to these a number of times, and that's why I think they've been really good, because they know exactly what to do. and know when to isolate people, when to test and trace, and shut whole places down as quickly as possible. We were very slow, unfortunately. We really should have learned from what was learned from the Far East. But what we do know is that our immune systems and herd immunity and all of that will start to take over. So we're in a much better position than we were 6 months ago. You know, when we were expecting second waves and we knew it was happening, yet we still didn't shut down as much as we should have done to save the economy. Whereas if you look at the Far East economy, it's doing okay, thank you very much, because they looked after health first. Well, we've finally, and without getting too political, we've finally got that on board, and we've done fantastic with the vaccination.
Yeah.
So
Absolutely.
I'm hopeful that things start to happen, but you know, Europe are going through a third wave now. So will we get foreign travel? I'm really hopeful that we are, but I still think we've got to see what this winter's going to be like. So I think we really need to be careful and just get the next winter over and done with, and then I think we should be able to look up quite well.
Yeah.
That's the
Excellent.
best that I can get, I'm afraid.
Yeah, which is perfectly fine. You know, we can't ask you to you know, use a crystal ball. That's ridiculous. Shut up, Scotty. I don't know what's happening. It's my voice is going all queer. So that was absolutely fascinating. Thank you both so much. I can't wait until we can do this. Yeah, you do what you want.
Just one thing. We're getting a lot of questions about the side effects of the vaccines. It's been in the news. I didn't think we'd do much service if we ignored the fact about the worries about AZ and Pfizer and things like that. So the latest few days, it's all about high risk of clots. I think Europe panicked, like they did 2 months ago when they said the vaccines weren't covering the over 65s, and they halted the over 65s for the AZ particularly. And then the data showed that actually it was absolutely fantastic at covering over 65s. They shot themselves in the foot, because then their public over 65 lost confidence in the vaccine and stopped turning up to the vaccination centres, and their vaccination centres were empty. Ours have been full constantly across the board, across the country. We've done fantastically well, and that's why we've got such high numbers, and you can see the numbers dropping. Then they said approximately 45 combination of deep vein thrombosis, that's clots in your leg, and pulmonary embolism, so clots in your lungs. There was 45. What they said, there were 45 cases. What they didn't say was your background cases are exactly the same. So the number of people who haven't been vaccinated who are getting these types of clots is actually higher when you look at the studies. So AstraZeneca looked at 17 million, and their cases were actually higher in those who weren't vaccinated. But the headline news, particularly in Europe, was, oh, we're going to have to hold on until we look at the data more. Well, fortunately, MRHA, which is our authority, the WHO and the EMA, the European Medical Agency, have all said it's perfectly safe. So your chance of getting a clot, getting COVID, is so much higher. And then the association and you know, the British scientists were all just wondering how on earth this even made the news. It's a bit like me getting a vaccine and then crossing the road and getting knocked over and saying, well, you know what, the vaccine causes me to have car accidents, don't anyone have it. It was as basic as that. Of course, as we go on and on and on, we're going to find out more and more. But you know, a lot of these vaccines, you know, for example, the flu vaccine, when that first came out, we weren't allowed to give it to pregnant women. We weren't allowed to give it to children. We're only allowed to give it to over 65. Now we're trying to vaccinate as many people as possible because it's been shown to be safe. You know, we quite happily vaccinate pregnant women with the flu vaccine. And now the data is getting stronger and stronger for the AZ. So again, I think, I'm afraid, Europe have shot themselves in the foot again. In terms of scaremongering about the vaccines.
Well, people were definitely getting blood clots before the vaccinations. With the amount of neuro work I do, I can assure you it was definitely happening.
Well, exactly. It's you know, it's one of those conditions, I'm afraid. And you know, blood clots were happening way before COVID ever happened. But COVID, if you get COVID virus, that in itself increases your risk of blood clots. It's one, and I'm sure Becky would back me on that. You know, pulmonary embolism is so high in the extreme. You know, the 1% who end up in hospital end up getting pulmonary embolism and so forth. So you know. So I've been helping vaccinate all afternoon, and to be honest, most people haven't even asked the question. Some have asked, and quite sensible questions. You know, I've got varicose veins. Does that mean I should avoid the AZ? Well, no, you're perfectly fine to have it. I've got heart disease. You know, I've been told I had a clot in my lung. What do I do? And then you say, well, actually, you know, if you had a clot in your lung and you got COVID, your risk of having another one is much higher. Go and get the vaccine. You just need to be wary of any particular symptoms like swelling of your leg, acute shortness of breath. With a pulmonary embolism, you're not just short of breath like with COVID. You're very short of breath, find it very difficult to breathe, and every time you take a deep breath, it feels like a knife's going through your chest, or you cough up blood or anything like that. Those sorts of symptoms, COVID or non-COVID or no vaccine, you have to seek help. You don't put up with it without seeking help. So as far as I'm concerned, it's been a great success in this country that we've managed to vaccinate nearly 26 million people, and people have come forward and got it done. And soon, so we're hitting the over 50s now, and we're hopeful to hit the majority of adults by end of July, which is fantastic.
Absolutely, and funnily enough, you've played your part in a news headline today, Talib, because I just saw it pop up on my phone that it's the highest number of daily vaccinations in the program happened today. So well done you, and well done me, because I had mine today.
I think that, you know, the whole society's done, because you know, people have turned up, people have asked the right questions, and it's important to ask the questions, and there's lots of forums and your GP practices will answer those questions for you if you've got any doubt. And the beauty is you can turn up to the vaccination centre and ask the people. There's doctors available, nurses available, and if you're not sure, no one's going to push you. So you're better off, if you've got an appointment booked, go for it, ask the questions. If you're still not unsure, they'll say fine, book another time. But what you don't want to do is put it off, because you know, we want this country back open, and I think that's the only other solution, is to get as many people vaccinated so we're not passing it around. And you know, I'm so grateful we're in this country to be able to do that. Whereas Europe are now, they don't know what to do now, because they poo-pooed the AstraZeneca vaccine, Pfizer vaccine. You know, their clotting rates slightly lower than AZ, but it's only slightly lower, so it's not statistically relevant as far as I'm concerned. But there's not enough of it, and now they've got a smaller percentage of the country vaccinated, so it's not surprising they're getting a third wave.
Absolutely. And then for anyone who is going for it, I had mine today, and I can honestly say, and I mean this genuinely, I did not feel a thing. I was bricking it. Now I'm covered in tattoos, and the doctor or the nurse, when I said, oh, you know, I'm really nervous of needles, and then I took my sleeve down and she was like, are you serious? I was like, I am. I don't know what it is. It's a very different experience. And she went, trust me, you'll be fine. And I looked away and I was waiting for it. And she's like, okay, you're done. And I genuinely didn't feel anything. So for anyone who's nervous about having it done,
you normally feel a prick inside you.
I think you'll find I'm the one who does the pricking.
So it was worth me being on this podcast just for that moment.
Anyway, on that note, listen, thank you both so much. Really appreciate it. I'd like to thank Scotty, but he's contributed nothing.
Very little, very little.
So, but I do love you anyway. Have a lovely weekend, everyone, and we'll speak soon.
Thanks, everyone. Thanks so much.
Take care.
Cheers now.
See you later.
Bye.
Cheers, Becky.